Following a prostate cancer diagnosis, making healthy changes to your diet is one thing you can do to improve your overall well-being. Eating well does more than just help you maintain a healthy weight. It can also significantly reduce your risk of developing diseases, such as heart disease and osteoporosis, which can be more common following a diagnosis and treatment of prostate cancer. In this video, we'll look at some specific dietary recommendations to help you achieve a healthy and balanced diet.
Dale, have you checked out the nutrition guidelines for prostate cancer yet?
Yep, I got it up right here. It says I should be eating lots of fruits and vegetables, and they actually recommend things like tomato sauce.
Well, let's have pasta for dinner then.
Sounds great. Tomatoes are full of lycopene.
Tell me what that is again.
Lycopene's an antioxidant that's found in red foods.
Red foods like corn chips, your favorite?
They mean fruits and vegetables, really. Things like apples and tomatoes and strawberries. Lycopene comes up all the time in the discussions with a support group. It's supposed to be good for me.
Diets that are rich in lycopene may be beneficial for slowing prostate cancer progression, but more research is needed, as other studies have been inconclusive or have shown no effect at all. While the jury's still out on the role of lycopene in prostate cancer, foods that are rich in lycopene also tend to be rich in nutrients, and including lycopene-rich foods in your meals and snacks supports good health, and it's easy to do.
Well, then tomato sauce it is.
Sounds great.
And tofu.
Tofu?
Tofu.
Soy foods contain isoflavones that are similar to the hormone estrogen, but they act at a much lower level. Some studies suggest that soy foods and isoflavones in soy may provide protection against the development of prostate cancer and may lower prostate-specific antigen, or PSA, in men with prostate cancer, therefore slowing cancer progression. More research is needed, but there are many other benefits of soy foods that make it a part of a healthy diet. Soy foods such as tofu and soy milk are plant-based substitutes that are high in protein and in fiber. Look for soy products that are fortified with calcium and vitamin D. Most people's diets contain relatively low amounts of these nutrients, but they are especially important for men with prostate cancer who are receiving androgen deprivation therapy. They promote bone health, and they taste great.
Thanks for agreeing to leave the ground beef out of the pasta sauce. Since Megan's gone vegetarian, I'm a bit concerned that she's not getting enough protein in her diet. Besides, you're supposed to be having more plant-based stuff yourself, too.
Well, I'm on board, but you owe me one.
Oh, really?
Well, you know I do love my steaks. But I'm okay with more plant-based food, too. What do you think you're going to do with this one?
I thought I'd try that marinated tofu recipe of Megan's. It's delicious and high in protein, too.
Yeah, that was pretty good.
Evidence suggests that plant-based diets, especially when combined with physical activity, may slow prostate cancer progression. Plant-based foods have a number of other health benefits, including improvements in cholesterol and body composition, and even small changes in your diet, like eating more fruits, whole grains, and veggies, can increase the amounts of phytonutrients and fiber that you're getting. And they tend to be lower in saturated fat. When choosing plant-based proteins, look for soy and quinoa, or combine different protein-rich foods like rice and beans to make sure you get all the essential amino acids your body needs.
Hey.
Hello.
Hi, Meg.
Hi, Meg.
Smells good. When's dinner?
Well, it'll be a bit longer to heat up.
Okay.
Hey, we got time for some snacks.
How about I brought some homemade hummus?
How about with these?
It'd be even better with the veggies.
Okay. Carrots?
Processed prepackaged foods like cakes, chips, and dip, and ready-to-eat meals tend to be higher in sodium, saturated fat, and sugar. So try to choose unprocessed or minimally processed foods like fruits and vegetables. This can help you reach a healthy weight while lowering your risk of chronic disease. There are a lot of tips and tricks that can help you do this. Cooking homemade meals from scratch gives you more control over your diet and can help you make healthier choices. Try keeping cut-up vegetables and fruit in the fridge for a quick snack, or doubling your recipes so you have leftovers and aren't easily tempted to reach for prepackaged convenience foods the next time you feel hungry. Eating at home gives you more control over portion size to help make balanced meals. aim to fill a quarter of your plate with protein-rich foods, a quarter with grains, and half with brightly colored vegetables and fruit. Keeping these proportions in mind when serving meals can help you meet your daily nutrient requirements and understand which foods you need to eat more of and which foods you need in smaller amounts. It's one way to set yourself a course for better health.
That is very good, and I do not miss the meat.
Now, that video was Dr. Rachel Murphy, and Dr. Rachel Murphy was the one that recommended Andrea. She told me, Andrea, you are the specialist in regards to this. We have Andrea joining us from where, Andrea? Please introduce yourself.
Yes.
Tell us your story, please.
Okay, thank you, Lori. My name is Andrea Holmes. I am a dietitian. I'm joining you today from my home, and I live in Surrey, British Columbia. I've been a dietitian for about 25 years. I work in BC at our BC Cancer Center in Surrey. And I also work for the Prostate Cancer Supportive Care Program. So I'm there 1 day a week. And I've worked in the area of nutrition and cancer for the majority of my career. I've worked with a number of people with various different types of cancer, but I do focus on prostate in my 1 day a week position with the Prostate Center. So that's a little bit about me. And so I think that video provided a lot of information in just that 6-minute time frame. There's a lot that you could, digest out of that to apply to your life that can help to optimize your nutrition. But I just want to say that it would be for many people, but probably not all people, because we all have different nutrition needs depending on other health conditions that we might be living with, but also related to how prostate cancer is affecting us and impacting our appetite. So that video really speaks to a healthy way of eating when you have a good appetite. So you're not facing any challenges with eating enough to just sustain a healthy body weight. Oh, my little cat is coming here in case you see. So there may be times also if people are actively going through various cancer treatments, such as radiation to the pelvic area, where that way of eating also might not suit you very well because it might just be a little bit too much fiber for the body to handle during that acute treatment time. But once your body settles after your bowel normalizes, that would be something to strive for when going forward.
Now, Andrea, you mentioned oh, heaven's sakes, in regards to nutrition and appetite. And with certain hormone therapies, there is an increase of appetite, correct?
Yeah.
We as women, we know that. We've gone through menopause, but men actually go through menopause too. And when they're on hormone therapy, it kind of heightens things. Do you have any recommendations?
Yeah, so with the hormone therapy or androgen deprivation therapy, ADT, it is common to have increased appetite. And even without increased food intake or even weight gain per se, people can experience a change in their body composition with a gain in fat tissue and a loss of muscle mass. So even though your weight on the scale is staying the same, there's that change in body composition, but more typically we actually see the scale weight increasing as well. Yeah, so the plate method there that Dr. Murphy mentioned, I think is a really great tool to help because it it does encourage a high fiber intake when we are filling half our plate with plant foods. And fiber can be very filling, so giving that satiety factor so that you're not feeling left empty, so to speak, after eating a meal. Additionally, when you have increased appetite, I think taking time to be mindful with our food and eating the food can help some people, just slowing it down. Most of us, eat a meal in 15 minutes or less. And there's not always the time to kind of allow our mind, our brains, to get the signals from our digestive system that we've actually had enough nutrition. So we all have busy lifestyles and we're trying to squeeze those meals in, but sometimes taking time to really slow it down and chew the food. And they say be mindful. So you're noticing all aspects of your food, the flavors, the textures in your mouth, even to the point where you're like, and you're not going to do this with every meal, but that you're feeling your food going down your food tube. All of this mindfulness can help sometimes to allow that satiety piece to connect. So the hormonal connections that happen between your digestive system and your brain. Other things that can, I was just going to say, other things that can definitely be helpful is integrating some physical activity after meal times, because sometimes we see that people have more difficulty regulating blood sugars. So that can be really beneficial to take the time for just a brief, brisk movement of some type, 10, 15 minutes. Sometimes they say to people who aren't used to doing activity, just try to get 100 steps in after you eat your food so you don't just sit down right away afterwards.
Mm-hmm. Well, thank you, Andrea. What I'm going to do, though, Andrea, don't mind me, I'm putting my water down. What I'm going to do is I'm going to go around the room and ask if anyone has any questions via the Zoom, please pop it into the chat, and I will ask Andrea. Is there anyone in the room that may have James?
Andrea, thank you so much for your wise words. Laura, you mentioned water, and I know that hydration is so important, and you've talked a lot about food, but can you talk a little bit about hydration and what that means for prostate cancer treatment?
Well, hydration is important for everyone. And for most people, we need at least 6 cups of liquid in a day, 8 to 12, depending, larger body sizes, we need more. Or if we're losing extra fluids, for example, if we're having loose or frequent bowel movements during time of pelvic radiation, we may need additional hydration. And with chemotherapy too, hydration is so important. With the hydration, making sure that you focus first on water as your fluid of choice, because especially if you're not wanting weight gain, you don't want to take in extra calories from a liquid format. So water being one of your best choices. If you're dealing with diarrhea, though, you may need to focus on some electrolyte solutions or some diluted fruit juice or Gatorade, because your body will be losing some of your body salts, like potassium, for example. I think with hydration, the other challenge I hear from people is because of the bladder issues many people face, we subconsciously restrict our fluid intake, sort of as a way to kind of manage those bladder issues, So I do encourage people to try to get your fluid intake in before like 7 p.m. so you're not woken so much in the night to go for urination. Having a water bottle that you carry around, particularly ones that are clear, so you can actually see visually how much water have you had, and having a bit of a plan to say, like, okay, I need to empty this bottle by 1 o'clock, and then I'm going to refill it and make sure I empty this one by 4 o'clock in the afternoon. So you have a strategy to get all your fluid intake in the day. James, did that answer your question?
Does, and I really appreciate you talking specifically about urinary urgency, and I think I find myself I tend to limit my fluid intake because of that. So I have to be careful that I maintain enough fluid
every day. And you also pointed out, and for those who have had a prostatectomy or after radiation therapy, the importance of limiting caffeine and sugary drinks and acidy drinks and things like that, because that can irritate that as well. Correct? Am I correct in saying?
Yeah, absolutely. Those can be bladder irritants, so they can contribute to the frequency and urgency with the bladder. I always do like to say to people though, like I know we love our coffee, and I think there's always this trade-off, right? So coffee is something we can enjoy, and we may decide that, you know what, I'm willing to deal with a bit of the bladder urgency because I really want to have my coffee. I'm not willing to give that up. Or maybe I can reduce it or try a decaf. I mean, so I think we need to balance all of the choices we make around our diet with our personal preferences and what really is priority and important to us.
Great, thank you. Also sugar in the diet, and especially for prostate cancer. Can you explain more about that, please?
Yeah, so sugar is a really complex thing, actually. But I think that to make it very simple, I would say that everyone would benefit likely from reducing the sugar in their diet, because we know that in the Canadian diet, sugar is sneaking in so many different ways. Now, small to moderate amounts of sugar intake are not harmful to us. And there is this idea that it will cause cancer growth, and that's not actually true. So eating a moderate amount of sugar within a really healthy, balanced eating pattern, so enjoying a treat or something through the Christmas holidays, a piece of cake on your birthday, that should not change for people diagnosed with cancer. It would be just like anyone else. But I think there is really important things to avoid: sugary drinks. And I also encourage people to avoid fruit juice, even the 100% fruit juice, unless you cannot eat your fruits and vegetables in any other way. So, you have you cannot tolerate any fiber, you have a difficulty chewing food, then it would make sense to use juice at that time. Or you're dealing with a flu, nausea, or vomiting, you can't really eat food. But otherwise, what we're more interested in is how our body processes carbohydrate or sugars, and giving it in levels that are in moderate amounts. Because when we have excessive sugar or carbohydrate at one time, our body needs to produce and release a lot of the hormone called insulin. And we're learning more about insulin which is a growth promoting hormone, as maybe something that stimulate cancer cell growth. So if we don't need as much insulin because we only have a moderate amount of carbohydrate, typically 30 to 60 grams of carbohydrate in a meal, which works out very well if you keep to that quarter of your plate for your grain type foods, about 2/5 size amounts. If you're having like some rice on your plate, your body will process that really well. Now, when you drink a soda pop, you're getting in that small volume, at least 30 grams of sugar, and you get it very quickly without any addition of protein or fiber or fats to slow down the absorption of that sugar into your body. Blood sugars spike up really high, and body needs to release a lot of that insulin to regulate blood sugars. So we do want to avoid those kind of scenarios.
Thank you very much, Andrea. And I'm going to ask everyone, yes, go for it. Yes, please.
Did I understand you correctly saying that insulin may promote growth of cancer?
Excessive insulin levels. So insulin is a hormone that's in our body, and it regulates blood sugars. We absolutely need it. People who don't produce enough insulin can have a condition called diabetes, so type 1 diabetes, they're not producing the insulin. Type 2 diabetes, it can be a combination of reduced insulin production and decreased insulin sensitivity. And there can be this period of time where, because of that decreased insulin sensitivity, the body is producing excessive insulin levels. So it's the excessive levels that we want to avoid. And we can do that by moderating our carbohydrate intake, choosing foods that are whole grains rather than refined grains, and avoiding excessive intakes of added sugars. Does that clarify for you?
Told for about 20 years that I was borderline diabetic. went back to Regina, and apparently I crossed the border somewhere because they put me on metformin. And I didn't have great experience with that. I quit taking it 2.5 years ago. Finally broke it after a couple of months ago. But I've been fine. My blood sugar and everything is stabilized. And I have a thing about metformin. I have had bad experiences with it. And to hear you say that it may promote cancer growth with the insulin release, and that's what that stuff does. Thank you.
Yeah, so I want to clarify, I don't mean insulin, it's the excessive insulin level. So that metformin doesn't cause excessive insulin levels. It helps your body produce the insulin when you're not producing enough. And so for people living with prediabetes or diabetes, what the important thing is to control those blood sugars, because it's when we have excessive levels of sugar in the blood that the body is trying really hard to produce extra insulin to manage it. And so, you know, if your blood sugars are elevated, and the medication like metformin was not well tolerated, you may want to talk to your doctor about alternative medications, or, you know, really focus on lifestyle, and that would be your diet and physical activity to help manage blood sugars.
My blood sugars run between 5.5 and 6.5.
Yeah, so that sounds good. So continue to monitor your blood sugars because things can change. So doing some finger pokes at home, or at least getting your A1C checked every 3 months so that you're on top of understanding, because it's silent inside your body, right? Without getting the test, you don't really know what's going on.
Thank you, Andrea. We have one question online, and it's Guy. Please ask your question, Guy.
I was just wondering, I read before that we shouldn't be concerned with natural sugars coming from fruits as far as sugar content, but I'm just wondering what your opinion is about that, because it is sugar, and if you're increasing your diet, like with the recommended fruits and vegetables like bananas, oranges, apples, you're taking a lot of natural sugar, and should a person be concerned with that?
Thank you for the question, Guy. No, you can continue to eat fruits and vegetables. I recommend them in their whole format, whether they're fresh, frozen, or canned, unsweetened. They're all going to be good. And the reason that we don't have to worry is because, you know, in a piece of fruit or a serving of fruit, you're getting usually about 15 grams of natural sugar, but it's packaged along with a lot of fiber and cell tissue that prevents our digestive enzymes from releasing that sugar from the fruits really quickly. So for most people, they can eat fruit on their own. For some people with a very poorly controlled diabetes, they need to make sure they pair up the fruit, which is a carbohydrate food, with a protein food. So you might have something like plain Greek yogurt with your half a banana. And with fruits, I always, you know, encourage people to integrate berries when those are available, frozen being a great choice, because the carbohydrate content is really low. Actually, like for blackberries, you can have about 2 cups of blackberries for the same amount of sugar in a small banana, or a cup of blueberries. And so that would be a nice, you know, way to integrate extra fruit. Portion does make a difference. Like with grapes, you're getting 15 grapes for 15 grams of carbohydrates. So but for most of us, we don't really need to think about those portions, and just, you know, having about 3 servings or so of fruit a day, and then trying for about 4 servings of what we call non-starchy vegetables, which will be everything other than potato, yam, and corn. So all those other vegetables, you know, broccoli, cauliflower, peppers, onions, asparagus, celery, you know, everything else basically is things that you want to load up on your plate.
What about nuts? Nuts?
Nuts.
Oh, yes. Nuts. Nuts, we would call nuts a protein food. So they're not a fruit or vegetable. So if you can remember back to that visual of the plate, we were seeing half the plate filled with our vegetable or fruit, a quarter plate for our grain foods, and the quarter plate for our protein food. So nuts fall in the protein group. And nuts are very healthy to have. So very rich in cancer-fighting substances, great source of protein and healthy fats. They are really rich in calories though. So if we are concerned about weight gain, we probably need to limit and really cap it at not more than a quarter cup of nuts a day. And I'll just say, if you're already maintaining a weight and you're like, oh, nuts are so healthy, I don't want to add them in, you just add a quarter cup as a snack, no other changes to your diet, you're likely going to gain weight because it's in addition to the food that you've regularly been eating. So you might want to use nuts as a substitute for some sort of animal food in your diet. So again, going toward a more plant-based focus, nuts being a plant-based protein.
Okay, we have time for just one more question. And was there anyone else in the room that had a question for Andrea?
Carrot juice? What about carrot juice? Is there a lot of sugar in that?
Can you say the question again, please?
Carrot juice, Andrea. Is there a lot
of sugar in real carrot?
I don't know off the top of my head the actual amount. I believe that about a cup of cut up carrots might be about 15 grams of carbohydrate. So the thing with juice is we usually need a many pieces of fruit to make a glass of juice. And I don't know how much carrots we need to make it. So what I would say is if carrot juice is something you'd normally like, maybe you can check the package. Food labels can be a really great tool to find out how much sugar by reading the label, the nutrition facts table. Under the carbohydrate section, it will say sugars, and then you can get a sense of what that would be there.
Thank you, Andrea. I just wanted to say, Andrea, there are a variety of different types of sugars like glucose, fructose, sucralose. I don't know if I'm pronouncing that all correctly. You're the dietitian. You're the expert in that. But is there one type of sugar that's better than another?
So we can broadly classify sugars as what we call nutritive or non-nutritive, or we might also think of this as artificial or natural sugars. And we're thinking of those artificial ones that don't, they impart sweetness, but they don't actually give us calories or very, very few calories. So artificial sweeteners being things like the product Splenda or sucralose, aspartame, and we do find these more in like candy products or maybe sweeteners in drinks. So these sugars don't raise blood sugar levels as compared to our natural sugar sources such as white sugar, sucrose, brown sugar, honey, maple syrup, agave, coconut sugar. So when we're looking at our natural sugars that do raise blood sugars, they're really not different. The carbohydrate content is the same. And people want to sometimes say, oh, well, is it better to have honey because it's natural? What I say is use the type of sweetener that you enjoy the most and try to use the least quantity that you can enjoy. That will be probably the best way to benefit your health, because from a micronutrient standpoint, you have to be eating large amounts of honey or maple syrup to have some sort of nutritional advantage that way. When it comes to the non-nutritive sweeteners or artificial sweeteners, I mean, I encourage people to try to do what makes sense for you, but as much as possible, try to enjoy the natural sweetness in our foods. And if we're accustomed to, like we say, oh, we've got this sweet tooth, we've always lived with this sweet tooth, is to kind of gradually wean ourselves off some of those really sweet food if it's an area that we feel isn't serving us well in our lives. As I said, everyone can enjoy a cookie, an ice cream cone, a piece of cake. But if we feel like the quantity that's in our diet is not serving our health and we feel like we should bring it down, go slowly, because your taste buds will adjust, but it takes time. And as you wean yourself off, you will find like you enjoy the natural sweetness found in fruits much more than you did before. And then if you go back to eating like that apple fritter, you hadn't had it for a long time, you're like, oh my goodness, it feels like someone's pouring the sugar bowl down my throat. So, but it takes time, and it can take a long time, like 6 months, a year. It's not something that happens in 2 weeks. changing our food habits is a complex thing, and we always have to kind of make a plan. We work at it, we slip back into our old habits, we catch ourselves, we get back on it, but it can happen over time. I do want to, and the reason I said that is I would like people to move away from those artificial sweeteners, not only to benefit the diet quality and enjoy food more, but there is very preliminary, very preliminary, but it is out there research saying that these artificial sweeteners might affect our microbiome. This is all these bacteria that live in our gut, just learning like tip of the iceberg and understanding how the microbiome affects our health. But so far what I'm seeing is that it's saying that these artificial sweeteners probably have a negative impact on the microbiome.
That will probably be a future meeting with you, Andrea, because that sounds interesting.
So-
Is that kind of like prebiotics and probiotics?
That's right. Yeah.
So that'll be a future meeting. I'm going to let James ask
I
this
just
question.
see that Guy has his hand up. Guy,
No.
Well, I probably had my opportunity because I know we're running out of time, but I was going to ask a quick question about the consumption of meat. But while we're on sweeteners, I was just going to ask your opinion about stevia, because it's not so much an artificial one as a plant-based one. I just wondered if you had a comment on that.
Yeah, so I have to admit I don't know a lot about it, but that we don't need a really large amount of stevia, and you're right, it's from a plant. In regard to that microbiome effect, I haven't seen anything on that. So I think, that might be an option to give a try, but I'm sorry, I don't know a lot there to really give a fulsome comment.
Andrea, I just want to say thank you.
Yes.
On behalf of everyone here and joining us online, you obviously, you know nutrition, and you know the human body, and your expertise is really helpful and appreciated here. I didn't have a chance to ask my question, but it would have been around protein intake as we age, and the requirement to continue not to lose muscle mass, and what alternative sources of protein. Because I happen to be celiac, so I constantly look at labels and nutrition information all the time on everything I eat, and I know that protein is important for me. So it's something that I'd love to hear in the future and maybe another time.
Okay, I can give a brief comment if you wish, or if you prefer to wrap up, then I understand as well.
Depends how brief.
Well, I'll try to just say briefly, yes, protein is an extremely important nutrient, especially for people living with cancer. You tend to need more protein than another person in the same age without living with cancer. And with ADT, we do see that accelerated loss of muscle mass that naturally occurs with aging. So if an average, adult male over the age of, let's say, 65 needs about 1 gram of protein per kilo of body weight, a person on ADT needs at least 1.3 grams of protein per kilo body weight. And I know Guy had mentioned briefly the red meat. So we do want to move away from red meat as our protein. Chicken is a good choice, fish. I'm not saying you need to eliminate red meat, but when you're eating it, choose lean cuts. Up to 500 grams in a week is probably the mark where we want to stay below. And if we're able to integrate more beans and lentils in our diet, that is awesome for protein choices. Eggs are okay for protein, up to 1 egg a day, but I wouldn't go above that. And low-fat dairy products such as Greek yogurt, 1% or skim milk would also be a good protein option. But we do want to move away from those very high-fat dairy products, because there has been some concern shown for prostate cancer.
And you just mentioned a little bit about hemp hearts.
Oh yeah, I mean hemp hearts. So hemp hearts, hemp seeds, chia seeds, flax seeds, pumpkin seeds, sunflower seeds. All of our nuts and seeds are great protein choices, and also great source of healthy fats, heart healthy fats, which we didn't get into heart health, but that is another thing that people living with prostate cancer should be thinking about, is their heart health.
Okay, there we go. Well, like I said, yeah, thank you very much.
You're welcome.
And we'll have to have you in the future but the next time's going to be an hour long, okay? Full presentation. How's that sound?
We'll try to make it work. Have a happy holidays, everybody.
Yes, have a happy holiday. Merry
you.
Christmas, happy holidays, and have a great New Year's. Thank you very much.
You're very welcome. Have a good night. Bye-bye.